hypertension, blood pressure things for most of your career.
Yes.
What are some of the key issues in terms of hypertension that you see in the animal studies and you see it mimic obviously in humans, and the sort of effects that you see changing?
When we feed them the diet, we're wanting to get an increased blood pressure. We're certainly not wanting to see a very high blood pressure that's going to increase the risk of stroke or myocardial infarction, for example. We have done those sort of experiments in the past with some different models, but with the food-induced changes, the dietary-induced changes, we see an increase to say 155, 160 millimeters of mercury, whereas the spontaneously hypertensive rates can go up to 230, 240, 250 millimeters of mercury as systolic blood pressure. So the food-induced ones have never gone that high. So we see very few long-term changes or long-term damage from that degree of increase in blood pressure. But that degree of increase in blood pressure in humans is going to be the most common one in patients in hospital with heart attacks, for example. That heart attacks don't occur only on the very high blood pressure, they will occur over a range of blood pressure, but over a long period of time.
Yes, because the US cardiologists have dropped their high blood pressure range now from 130, 140 down to 130. So in the rats they decreased by about 10?
We saw a decrease of, no, we've seen a larger decrease, so from say 100 to 155 down to 125, 130.
So it's just as effective as the drug?
It's exactly the same. We put the drug in there at the right sort of dose, at a relatively reasonable dose. The two lines will be superimposable.